Hey, it's Jessica DaMassa with WTF Health, and joining me right now, I have Sara Holoubek. She is the CEO of Luminary Labs, and more importantly, she is my favorite person on Twitter who talks about undercurrents at conferences and generally in the industry. So, Sara, great to have you.
Thank you for having me.
I am so excited to talk undercurrents with you. So, generally speaking, digital health had a huge year last year. Is on tap maybe to have a bigger year? Who knows? Like, tell me what you're seeing from your vantage point. You stage a lot of open innovation challenges with companies in and out of healthcare, but in healthcare in particular, what do you think is going to be one of the themes to watch out for the year ahead?
Well, like most industries, I think we're a little worried about the market being too frothy.
Ooh, frothy.
Times are almost a little too good. And so one of the things I always say is that when you see too much bottle service at the parties, too much champagne flowing, that's when you should watch your back. And that's not just in health tech, it's really across the entire tech industry. But in health tech, there's been a lot of positive energy, and that's a good thing. But it hasn't always been tempered because investors have to put their money somewhere. And some of those bets won't be great.
Right. And I keep hearing, too, that there's a lot of money available right now, which I don't think is helping anything.
Yeah, I mean, it's a double-edged sword.
Right.
It's I think the problem is we need to decide which problems should get the money.
Okay. Do you have any input on that?
For a fee.
I love that. I love it.
I'm just kidding, Jessica. No, I mean, you know me. I love thorny problems that matter.
I know.
So I believe that you can do good by doing well, and business models that help people be well or live with the disease or live the fullest life possible is where you should really place your bets.
I was really setting you up to talk about Kidney X.
Well, yes.
So why don't we talk about that?
So one of the projects that we're working on right now is supporting Kidney X, the innovation accelerator that is spun out of HHS and ASN. And the idea here is kidney disease, unfortunately, is the 9th leading cause of death in America, and 1 in 7 Americans has kidney disease, or a kidney disease, I should say. And we haven't done anything in about 60 years to change how that is treated. So you might know somebody who's on dialysis, and they go to a dialysis center a few times a week and are hooked up to a machine for 5 hours. It's just inconceivable that we haven't figured out a better way to do this. Or in the case of what Kidney X is trying to do, eliminate the need for dialysis through perhaps the invention of an artificial kidney. Okay. So imagine an implantable or a wearable, which will require people from anywhere from data science to tissue engineering to come together to develop this innovation. And so that's an initiative that we're working on right now.
And we were talking a little bit earlier about how this is another undercurrent that you kind of see in terms of the way of what people are going to be focused on in terms of innovation. So say a little bit more about that.
So I mean, when you say chronic disease, people oftentimes think about diabetes or heart disease and increasingly cancer. We live with cancer like a chronic disease, but we don't really talk about kidney diseases because it's the last thing that happens to you. And because there hasn't been a lot of innovation, it hasn't been, quite frankly, hasn't been a very sexy industry to jump into. But that's going to change for a number of reasons, which is undercurrent number 3. The aging of America. So as we live longer and as we have less children, the demographics of America are going to dramatically shift. We are going to see upticks in diseases such as kidney disease or diabetes or heart disease. And so if you're an innovator, you really need to look at the demographics before you look at what is technologically possible, designed for real human need versus trying to find a fit for something that you dreamt up.
Do you think, as far as I'm going to push you into an undercurrent 4 here, I want to get your perspective because you are working with HHS, you work with other big organizations, specifically pharmas. I mean, how has their innovation capability evolved over recently? Because I feel like with the, especially with digital therapeutics becoming a thing in pharma, I feel like they've started to really embrace not only the digital in terms of what they could wrap around their own products, but also how do they digitize and how do they leverage technology in redoing their own internal processes. Are you seeing similar things with them? And is their innovation capability like becoming a little bit more open?
Yeah, it is. And, we've been in that space for the past 10 years.
Yeah.
So on our healthcare side of the business, we work with a number of pharmaceuticals on digital therapeutic planning. And it always starts with problem statement definition. So I think in the previous 10 years, there was a lot of look at this startup, look at that. Where could that fit? Throw it against the wall. And that's why we end up with pilot fatigue. And I'm really encouraged that today we have a lot of clients that say, can we start by defining the problem, the human problem, and seeing if it marries with the business problem. Now, why is that important? You might have a business problem, but humans don't really care about it.
Right.
And therefore, there's not a lot you can do. Or there might be a really beautiful human problem to solve, but your company doesn't have brand permission to do it. Or there isn't white space for a reason. So really thinking about that before you make an investment. So I'm seeing more a measured approach, more of a thoughtful sort of, not dipping the toe in, but just better process, better approach, more holistically thinking about it. And I do think competencies have matured. That being said, there's a lot going on in digital therapeutics today.
Yeah, there really is.
Good and bad. And so it's early days. It's early. So if you think about a molecular innovation, right? So it could cost you $2 billion to take a drug to market, and pharmaceuticals are designed to absorb that risk if it doesn't work, right? And they're also designed to reap the rewards if it does work out. We're not built, or pharmaceuticals are not built, to accept that level of risk for digital therapeutic. It's like, oh, you spent $20 million and it was a disaster? Oh my gosh, back off. So, I mean, that's interesting, right? So how do we have that same level of risk and tolerance? And I think there's a big myth in all things digital that it's cheaper and faster. And it's like, well, maybe, but not necessarily,
Right. You had said, I mean, I'm going to come back to what's the bad of digital therapeutics? Like, what are some of the downsides that you're seeing with that? Is there anything that you can speak to?
Well, I don't know if it's necessarily bad. I think there are a lot of unknowns. So we don't know what happens when you're on 3 digital therapeutics with different logins. Are there contraindications? I don't know. Should you have the same login? There are a lot of things that we just don't know. And I'm a big fan of all the digital medicine society work and the Digital Therapeutic Alliance. Like, they're doing a lot to educate the market on like what is or is not a digital therapeutic, the type of clearance you might need or not. And then what are the unanswered questions, such as, not knowing what happens when you're on 2 digital therapeutics. So it's sort of like not knowing what happens when you're on 2 different types of drugs if you have 2 different doctors. So I think there are a lot of unknowns. There's a lot of work to be done. I also think that we're seeing people get cold feet, right? Really? We've seen a couple partnerships, right? So without naming names.
No, without naming names, everybody knows who they are.
Yes, I know who they are. And that's okay. I think that's bound to happen. But I think it will be interesting to see what other investors think.
Yeah, that definitely will be interesting to see. It'll be interesting, I think, to see some of the exits that will take place or maybe not take place this year. Yeah,
maybe. Maybe that's the thing. And especially when times are really rich and frothy, if you can do that before the drop, like, great, good for you. But if we do see a downturn and everybody forgets that, recessions are cyclical, that, you might see some fire sales. And that might actually be a good thing in the end. You never know.
The other thing that I keep hearing about is that we're seeing a lot of like consolidation. Like, people are building more platforms. We're not seeing as many point solutions. We're not seeing as many, or we're seeing, I should say, different kinds of early stage startups than we saw maybe even just 2 years ago. Are you noticing the same thing from your vantage point?
Yeah, I think, people who have 10 years of experience in digital health, they've learned something, right? And so
Which 0.0 are we on, Sarah?
Yeah, so
3, 4 now?
Yeah, I think a lot about, when I jumped into this space, everything was really like a feature of some other thing that existed, like of an EMR or something like that.
Right.
And I'm very heartened by the number of people who are starting new companies that come from a background of maybe they worked in policy and then they worked in tech, so they see both sides, or they worked in a hospital system and at a pharmaceutical. So they're really looking at this holistically and trying to figure out what is missing, and it's very encouraging.
Yeah, absolutely. You mentioned policy, and I was thinking to myself, I'm like, do you think we're going to see, will this be the year of health policy? Because I almost feel like we're getting ready for it, especially with all the data questions that have come to light and some of the things you even talked about. I mean, just even some of the, maybe not policy, but more of like the ethical questions around like, well, what happens if you are taking multiple digital therapeutics? Like, you know what I mean?
Yeah. So I think in health, we think about policy a lot about like what you can or cannot do.
Right.
But doing a lot of work with the government, it's really important to remember that the government is open for business and they want to tell you what you can do and encourage you to do it. So going back to Kidney X, there was an executive order this summer that really changed the rules. Like, we are now in a new territory where it's ripe for innovation for, whether you're a data scientist or a tissue engineer or you're an investor, should really look at that space, because we're going to change in America how things are reimbursed. Everything from transplants. So it costs money to donate a kidney. You can be a living donor, by the way. A lot of people don't realize that, but it costs money, everything down to like childcare. Certain people used to be eligible to get those monies, right, to compensate for that. And they're trying to expand the breadth of people that can be eligible. And so that's a good thing because we don't have enough organs to donate. But also in terms of dialysis, right, and encouraging at-home dialysis, alternatives to dialysis, and maybe even an artificial kidney. So when the rules are changed, that means money.
Absolutely.
And we're spending a lot of money on this problem, just to be really, really clear, billions and billions and billions of dollars, and the outcome of patients is horrific. It's really not a good situation. So I don't think anyone's saying we have to spend less. We'd love to spend less, but what we really want is better outcome. So if it costs the same amount of money to have a better outcome, that's a good thing. If we can do it for less money, that's good too. But this is a really important problem to solve.
Absolutely. And I think it's not alone in a lot of these other things that have not neglected, but it's like we just haven't gotten around to them yet in terms of innovation. Yeah, right?
Yeah, absolutely.
So, I mean, we'll see what happens as far as this year unfolding. Do you have any predictions you want to weigh in on? Get it on camera? No? We've talked undercurrents, so I don't necessarily need a prediction.
Well, I mean, my biggest undercurrent this year is it's not raining at JP Morgan, and it's really freaking people out.
It really is. Do you think that this is like, it's blue skies. It's like terrifying.
Yeah, it's terrifying, which is it's so funny. Everyone's like, this is not good. I don't like this. And, we should talk in a year.
This is like the too much champagne. Better watch your back. The skies are too blue. The champagne is too flowy.
Exactly. And somebody told me the parties are not as good. I don't know. So that's how you know. Maybe, I don't know.
This is the beginning of the end?
Yes, we'll talk
Oh my God, Gatsby has died and it's all over. Here we are. It's all over. Sarah, it's always a pleasure to pick your brain. I love the undercurrents. And on Twitter, you're at Sarita, right? Yes.
Correct.
And so you guys need to follow her there because her undercurrents are some of my favorite things coming out of the conferences that she lovingly graces her presence with. So thank you so much for being here. I'm Jessica DaMassa with WTF Health. Thanks for joining us.